Dr. Greg Mendel, your friendly anatomy professor. We're going to continue on with the lower extremity. We're going to start with the femur. Come on over, let's take a look. So what we saw here just a few minutes ago is we looked at the acetabulum of the pelvis, and we see that basically this femoral head will fit right in there. And so what we're looking at when we see this structure, I'm going to sit down so we have a black background, it might be easier to see. So when we're looking at the femur, we see this is the head of the femur. The head of the femur is this round structure which will fit in an acetabulum, allowing ball and socket movements, and therefore flexion, extension, and circumduction, and quite a few movements. At the very top, we see that basically there's this fovea capitis, and that's in the very center point of the head of the femur. If we look here, and we see that there's this place that wraps around here, that is the neck of the femur, and we see, which is pretty obvious here, there's these two great big bumps. Posteriorly, you can see them better. This is the greater and lesser trochanter and the intertrochanteric line or intertrochanteric crest. Right about here, there's an area called the gluteal tuberosity, and so the glute max comes and attaches right there. When we look at this from the front, we see again this is all the shaft of the femur, and then we'll go down to the knee. When you look at the knee, we see a few things. First of all, there is these two projections, one on each side. If you look up here, we see, of course, the head of the femur going in this direction. That means this is medial. So this is the medial epicondyle. The lateral epicondyle. Sitting on top of this bone is the, sitting on top of this is the patella. We have a lateral condyle and a medial condyle. So condyle, epicondyle. Lateral condyle, lateral epicondyle. We have the patellar groove, which is under the patella. If we look posteriorly, again we have the medial and lateral condyles and the intercondylar fossa. When we look at the now tibia, we see the tibia, and beside it, we see the tibia, and beside it the fibula. We have the fibular head here, and on the tibia we have the we have the lateral and medial condyles, the lateral and medial this is lateral and this is medial epicondyle, and here in the front we see this bump on the front of the tibia. That is the tibial tuberosity. We see coming down towards the ankle, we have a lateral malleolus, which is part of the fibula, a medial malleolus, which is part of the tibia. We could see the thing keeps falling over. We can see the calcaneus here. We have the talus bone here. We have the tarsal bones here, and we're back to metatarsals and phalanges. Remember, we name it from 1, 2, 3, 4, 5, big toe out. We have a proximal, middle, and distal phalange, except on the big toe. Big toe does not have a middle phalange. And that's it.